Hello and welcome to my video presentation of my research project entitled Solar Panels and Healthcare in Conflict Zones, a case study of Gaza Hospital using GIS. Here we can see the content layout, but we're going to go deeper in the next slides. We know that Gaza has a network of public and private healthcare facilities, including 36 hospitals, that include Al-Shifa Hospital, that is the largest medical complex in Gaza, as well as the European Gaza Hospital. However, with the past and ongoing conflicts, there's been a significant damage to these facilities, including a chronic electricity deficit that undermines the already fragile living conditions of the people. And this is also additional to a destruction of critical infrastructure, including electricity and water supply system, impacting the healthcare delivery. Here we can see the electricity status in Gaza, in which we can see that on average 56% of electricity demand was not met from 2017 to 2023, and on average Gazans didn't have access to electricity for 12 hours a day. And we can see also that in 2024 there's been interruption of data availability due to the conflict. Looking more specifically into the effects of the electricity crisis in hospitals in Gaza, we can see that when this essential medical equipment powers off, it affects people on life support machines, premature babies in incubators, patients requiring dialysis treatment, as well as ambulance trucks that are unable to run and move patients from one place to the other. Here we have the problem statement, which basically means there's been no research conducted on the current status of hospitals in Gaza equipped with photovoltaic panels since the event of October 7, 2023, and also no research done on the resilience of these infrastructures as well. Here, the research objectives are to compare the level of damage caused by bombings between hospitals in Gaza with and without PV panels, and also understand if they have been operational, so resilient, and which ones are instead being dysfunctional. And lastly, to analyze the factors that influence the resilience or dysfunctionality of hospitals with and without PV panels during the bombings. We have the conceptual framework adapted from United Nations Satellite Center, in which we have the damage scale represented by 4 grades. First one is possible damage, mostly related to the debris still visible. Second is moderate damage, which is limited damage or usually just close to destroyed or heavily damaged buildings. Grade 3 is the severe damage, which means part of the building structure has collapsed, one or more walls, and lastly grade 4 destroyed, which means all or most of the buildings has collapsed. We want to understand what's the difference in the level of damage caused by the bombings in hospitals with and without PV panels in Gaza, and which one remained operational after the bombings and which one have been dysfunctional, and lastly, what factors contribute to the resilience or dysfunctionality of hospitals with and without PV panels during and after the bombings. Here we find the georeference hospital data sources gathered from UNOCA, WHO Health Cluster, Google Maps, OpenStreetMap, UNDP, SCSS, media articles, and UNOSAT for the identified points of damage, and WHO Health Cluster to assess the service status of the hospitals. Here we have a visual representation of the data. So for instance, on figure 1, we know that the dots with the H are representing the hospitals, whereas in figure 2, those with the red dots, the red H, are the functional hospitals, while the gray ones are the dysfunctional. And lastly, on the third image, we see that all the dots are representing damaged buildings without distinguishing between hospitals or other kind of buildings. For the data collection, we simply gathered the point data of all hospitals from the different datasets and also collected them from news articles and reports to identify hospitals provided with PV panels that have been hit recently to assess their damage and impact on healthcare delivery. To validate the dataset, I've cross-referenced the data from the 4 datasets in a minimum of 2 datasets and seen also if there's been any discrepancy with the names to resolve them with a majority consensus among 3 or more databases, and as well as eliminating all the duplicate facilities and private clinics. Mentioned before, now we can see that the spatial joining of the damage assessment of the data gathered previously. So the red dots that we now see are the actual hospital facilities damage on the ongoing conflict up to July 2024. And those that are in the background, as mentioned previously, are instead the all damaged buildings of the conflict. The data analysis, I've been trying to quantify the damage pattern. So from the final map containing all the damage points and all the hospital location, I've been trying to quantify the pattern of damage of these buildings. So basically, we can see here, for instance, the damage status with the from grade 1 to grade 4, the service status from the WHO health cluster, which distinguishes in not functional and partially functional, and we can also see if they are provided with PV panels and what kind of and how much energy could it provide. In this slide, we can see the quantification of the data. So for instance, one hospital has been severely damaged, which is the Victor's Children Hospital, while 24 are moderately damaged. But it's also important to see that 11 hospitals are still functional, while 14 are being not operating anymore. And 11 hospitals are provided with PV panels that before war were producing 680 kilowatts, and 14 hospitals are instead not provided with renewable energy. But we can see from the testimonials of the news that actually solar power can slow the depletion of the critical fuel reserves, as well as guarantee a minimum level of functionality for short periods. And this happened, for instance, with the Al-Shifa Hospital, Al-Wafa, and so forth. Here we can see more details on the 25 hospitals divided by type of hospital. So if with and without PV panels, the service status, if it was partially functional or dysfunctional, and also trying to assess what kind of destruction they were having. So if it was just some destruction and no electricity loss, or if it was primarily electricity loss, or both of them, or just major destruction, so grade 3 severe damage kind of scale. And here we can see that the hospitals with PV panels that are still functional have experienced some damage on the facilities, but they're still going. For instance, we have the Ali Arab Hospital running with 30% capacity, or Al-Aqsa Hospital that still has one generator. Whereas we can see that the other hospitals were destroyed not only from a building point of view, but also from electricity. And those are also without PV panels, so without a backup power. So with these findings, we can say that 55% of hospitals equipped with PV panels still remain operational compared to just 29% of hospitals without PV panels. And this backed up by testimonials and also by the previous metrics identifying the kind of damage of operativity. So if it was just destruction of buildings or electricity loss, we can see that actually solar energy significantly can improve hospital resilience, because it not only extends the availability of healthcare services, but it can also provide a backup power during the blackout, so during power outages. So it's a vital component to sustain hospital life-saving services. But to understand the factors underlying this functionality and resilience, the next steps are going to be gathering information from email interviews with hospital staff and or UN agencies. This study contributes to understanding the role of solar energy in Gaza hospitals during the conflict, and also how they can impact the reliability of electricity supply and enhance resilience of these hospitals, supporting their healthcare services. Of course, there are some limitations regarding to the data due to the conflict, so the accuracy of the data may not be complete and precise, as well as the resolution of the GIS data on a damage assessment. But we can also improve by incorporating qualitative data from interviews with healthcare providers or patients to gain deeper insights on the challenges and coping mechanism in this context. Here are the references, and thank you so much for listening.